All right, so today we're diving into something a bit different than usual. We're looking at medical emergencies, not the car crashes and that sort of thing, but what happens when someone's body kind of turns against them. We've got some EMT textbook stuff and some lecture slides, so let's see what we can pull out of these.
You know, it's funny. People hear medical emergency and they think heart attack, but it's so much more than that. I mean, we split emergencies into medical and trauma, but like the textbook says, it isn't always so clear.
Yeah, like that example they gave, someone's have a heart attack, they're driving, and boom, they crash the car. Now it's both.
Exactly. It's like we always say, you treat the patient, not the textbook. Got to be ready for anything. And that's where that index of suspicion thing comes in. You get a feeling something's not right, even if you don't know what it is yet.
So before we get into that, let's break down the types of medical emergencies you might actually see.
Oh man, there are so many. Respiratory emergencies are big asthma, emphysema, that kind of thing. Then you've got the height stuff, heart attacks, congestive heart failure, and of course neurological emergencies like seizures, strokes, even syncope.
Seem to peel, okay, gotta admit, not one I know off the top of my head.
It's just a fancy way of saying fainting. We've all been there.
Good to know. So we've got breathing problems, heart problems, brain problems. What else?
Well, don't forget about the digestive system, appendicitis, diverticulitis, pancreatitis. Those are the ones that'll make you wish you stayed home. Then there are urologic emergencies, people with kidney stones, man, that pain. Endocrine emergencies, diabetes related a lot of the time. Those can be tricky. Plus, you've got blood disorders, immune system problems, toxins, even psychological and behavioral emergencies.
Wow, that's a lot to keep straight. Is there like a quick reference for that in the field?
That's where Table 1501 in the textbook is a lifesaver. It's like a cheat sheet for medical emergencies, lists out common conditions and what to look for.
So it's less about memorizing everything and more about recognizing the patterns.
Exactly. So let's say you show up on scene, someone's having what looks like a medical emergency. What's your first move?
I think getting a good patient history would be important, right?
Absolutely. Unlike trauma, where you're looking for injuries, with medical emergencies, it's about understanding the illness itself. What are their symptoms? Why did they call 911 today? That's their chief complaint.
So it's like detective work, figuring out the story behind the emergency.
Exactly. And just like a good detective, you got to ask the right questions. Allergies, medical history, what medications are they on? Especially important for elderly patients, they often have a whole bunch of medications.
The textbook even said to bring their medications with them to the hospital.
It's super helpful for the doctors. Now, getting all that information isn't always easy. People can be scared, confused, even angry.
Yeah, and it's easy to get frustrated, especially if someone seems like they call 911 all the time or they're downplaying their symptoms.
You got to remember to stay calm, be non-judgmental. Every call is different. That guy who seems drunk might actually have a serious head injury. Never jump to conclusions.
So you're on scene, you're keeping an open mind, you're trying to gather information. What are the actual steps you take to assess a medical patient?
Scene safety always comes first. Make sure it's safe for you and the patient. That includes taking standard precautions, gloves, eye protection, all that.
Okay, so safety first. What's next?
Then you move on to the primary assessment. Get a general impression. How sick did they look? Are they moving around or just lying there? Are they awake, talking? Or are they unconscious? That gives you an idea of how fast you need to act.
So you're gauging the urgency of the situation. Then what?
You need to figure out their level of consciousness. We use something called the AVPU scale for that.
Break down that AVP scale for us. What does it tell you, and how do you actually use it in the field?
It's a quick way to check their mental status. A is for alert, they're awake, talking, and they know where they are. V is verbal. They respond when you talk to them, even if they're not totally with it. P is pain. They only react if you give them a little nudge, like a sternum rub. And U, well, that's unresponsive. They don't react to anything.
So depending on where they fall on that scale, you can get a sense of how serious things are. What happens next?
Airway and breathing are next. Huge priority.
Uh,
Are they breathing at all? Is it fast, slow, struggling?
So there's more to it than just looking to see if their chest is moving up and down?
Way more to it. You listen for weird sounds, like wheezing or gurgling. You might need to open their airway, maybe even use an airway adjunct.
You're constantly thinking on your feet, making decisions based on what you're seeing and hearing. What about circulation?
You check their pulse at the wrist if they're conscious, in the neck if they're not. You also look at their skin. The color, temperature, is it dry or clammy?
It's amazing how much information you have to gather so quickly.
You gotta move fast. Every second counts in this job.
Okay, so you've done that initial assessment. Time to load them up and go.
It depends. Someone who's unconscious, acting strangely, having trouble breathing, problems with their circulation, or if they're really old or really young, those are automatic red flags. Gotta go, fast. If they're stable, we can stick around, keep assessing, maybe even start some treatment before we transport them.
So it's a judgment call based on how they're doing. What about in those really time-sensitive situations, like if it's a heart attack or a stroke? Do you just go straight to the nearest hospital?
That's where knowing your transport options comes in. Sometimes a helicopter is the fastest way to get them to a hospital that can handle their specific problem, especially if we're far out.
So air transport is like the medical express lane. Makes sense. You want to get them to the right place as fast as possible, really.
Exactly. You don't want to take someone having a heart attack to a hospital that doesn't have a cath lab. That's just wasting precious time.
Right. You want them to get the right care and fast.
And remember, our job as EMTs is to manage their condition and get them to that care. We can't do everything a hospital can.
Good point. You're a vital link in the chain, but not the whole chain. We've covered a lot of ground here: how to assess a medical emergency, when to call for more help, how to make those critical transport decisions. But there's another layer to all of this, right? Infectious diseases.
Definitely. As EMTs, we have to be aware of the risks to ourselves and our patients. We have to protect everyone.
Let's dive into that world next. What are some of the most important things for EMTs to know about infectious diseases?
Infectious diseases, they really show you how connected we all are. Like each call we go on, it's one person's story, but these diseases, they can affect so many people, it's a whole different scale.
It's like individual emergencies are just one piece of the puzzle, but infectious diseases, they're the whole picture.
That's a great way to put it. And just like you need a plan to put a puzzle together, we need things like vaccines, tracking diseases, and stopping them from spreading to prevent big outbreaks. But even with all that, we still see infectious diseases all the time. So how do we deal with that in the field?
The textbook talked about some tough situations, like what if your patient is unconscious? Or what if you've got an elderly patient who's on tons of different medications? Where do you even start when you don't know what's going on?
Those are the calls that really make you think. With an unconscious patient, you're like a detective at a crime scene. You have to check everything, head to toe, looking for anything that might tell you what happened.
Looking for any signs of injury, checking for a medical or bracelet, looking at their eyes, things like that.
Exactly. And you're also paying attention to their breathing, any weird smells, checking their vitals. You're gathering as much info as you can, even if they can't tell you what's wrong.
It's like medical detective work, for sure.
That's what it is. And just like in those detective shows, every little detail matters. Now, when you get an elderly patient on a bunch of meds, that's a whole other challenge. They could have a bunch of things wrong with them, and those meds can interact in crazy ways, making it really hard to figure out why they're sick right now.
How do you even wrap your head around all of that?
Talking is key. Talk to the patient if you can, their family, anyone who can tell you what meds they take. Maybe they have a list or one of those pill organizers. Anything helps.
Right. The textbook mentioned bringing all their meds to the hospital with them, too.
Huge help for the doctors. It's like giving them all the pieces of the puzzle so they can put it together.
I like that analogy. Speaking of getting the right people involved, the textbook also mentioned how important it is to recognize when you need to call in advanced life support, or ALS.
For sure.
So how do you know when to make that call? When is it time to get ALS on the scene?
Well, there are some situations where you always want that higher level of care. Heart attack, stroke, serious breathing problems. But honestly, sometimes you just have to go with your gut. If something feels off, the patient's getting worse, or you're just not sure what to do next, don't hesitate to call for ALS.
Better safe than sorry, right? Always good to have that backup when you need it.
Exactly. Now, let's get back to those infectious diseases for a second. We've talked about the patient, but what about stopping the spread of infection?
Right, because one sick person can quickly turn into a lot of sick people if we're not careful, right?
Exactly. The textbook and those lecture slides, they were big on following standard precautions for everyone. Gloves, mask, eye protection, every single time. And always follow your agency's rules on cleaning stuff and getting rid of anything contaminated. It's important.
So we're not just protecting ourselves, we're protecting our partners and all the other patients we'll see in the future, too. It's easy to forget about those things in the moment when you're focused on taking care of someone right in front of you.
It's true, but it has to be automatic. You just do it without thinking. But remember, taking care of people also means treating them with kindness and understanding, especially those with infectious diseases. They might be scared, feeling alone, even judged.
That human connection, it really makes a difference, no matter what the situation is.
Absolutely. And as EMTs, we should always be learning. These infectious diseases, they're always changing, so we have to stay informed about new threats, new guidelines, all of that.
Where do you even go to keep up with everything?
The CDC website is a goldmine. They have everything you could ever want to know about infectious diseases, how to prevent them, how to treat them. It's all there. I check it all the time to make sure I'm giving my patients the best care possible.
This has been eye-opening. We've talked about so much from those first few seconds on a scene to knowing when to call for more help. We've talked about unconscious patients, getting a good medical history, and those medications, especially with elderly patients.
And we can't forget about compassion, empathy, and always learning. But sometimes, the best lessons come from experience.
I was just thinking that. Do you have any memorable calls, maybe involving a medical emergency or an infectious disease that really stick out in your mind? I was hoping you'd say that. What story comes to mind?
Oh, there's one I'll never forget. Seemed like a simple call at first, sick person, but it turned out to be anything but.
Okay, I'm hooked. Tell me more.
So we get to this tiny apartment, and there's this young woman on the couch, white as a sheet, just drenched in sweat. Her friends freaking out, saying she's got this awful stomach pain, can't stop throwing up.
Sounds like a classic stomach bug, maybe food poisoning. Anything seems strange at first.
That's just it. On paper, textbook gastroenteritis. Vitals were pretty much normal. Her stomach wasn't hard or anything. But something just didn't sit right with me.
Your index of suspicion was tingling, that gut feeling that something more was going on.
Exactly. So I took a little extra time, asked about her medical history. Turns out she had endometriosis.
And that's when things clicked.
Ding, 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 like a light bulb went off. Suddenly, those vague symptoms meant something totally different. Endometriosis, it can cause these cysts on the ovaries, and those cysts, they can rupture.
Oh, wow. A ruptured ovarian cyst? That's not something to mess around with. That's a surgical emergency.
100%. And the thing is, the symptoms, the pain, the nausea, the sweating, they can look like something minor, especially early on.
So you might have caught something that could have easily been missed if you hadn't really listened to her and thought about her medical history.
That's why we say listen to your patient. They'll tell you what's wrong. Sometimes you just got to listen carefully. We got her to the hospital, and yeah, ruptured cyst. Needed surgery, but she recovered just fine.
That's an amazing story. It really shows how those textbook symptoms can mean something way worse than you think. Being a good EMT is like being a detective, putting all those clues together.
Exactly. You're treating a whole person, not just a list of symptoms. Everyone's different, their medical history is different, and all that matters when you're figuring out what's going on and what to do.
Well, I think you've given our listeners a lot to think about today. We've really gone deep into the world of medical emergencies and infectious diseases, those crucial first moments on scene, and how important it is to never stop learning.
We've seen how those lines between medical and traumatic emergencies, they can get blurry, how important it is to stay calm and reassuring for our patients, and how those little details and gut feelings can be the difference between life or death.
We talked about the challenge of assessing unconscious patients, getting a good medical history, being aware of those medication interactions, especially in older patients, right?
Absolutely, and we can't forget those infectious diseases. Always follow your precautions and treat every single patient with compassion and empathy, no matter what.
As we wrap up, I want to leave you all with this. Never stop being curious. Never stop thinking critically. Never stop wanting to learn and grow as an EMT. The more you know, the better prepared you'll be when those critical moments arrive.
I couldn't have said it better myself. It's an honor to do this work, and it never ceases to amaze me how resilient people are. To all my fellow EMTs out there, stay safe and keep up the incredible work.
And to our amazing listeners, thank you for joining us on this journey into the world of medical emergencies and infectious diseases. Remember, knowledge is power. Until next time, stay curious, stay informed, and stay safe.